All right, let's dive into testosterone today. You sent over these guidelines from the American Urological Association,
Mhm.
and wow, there's some really interesting stuff about testosterone deficiency in here. We've all seen like the huge increase in testosterone prescriptions
Mm.
recently, right?
Yeah.
And it seems like this guideline is giving some much needed clarity for doctors and patients because, it's not just about low T levels, it's
No.
about the whole picture, symptoms and everything.
Yeah, I think what's really fascinating is that the guideline gives us like a concrete starting point
Oh,
for actually like diagnosing testosterone deficiency. So it's not just, based on someone saying, "Oh, I'm feeling a little sluggish."
right.
So it's more than just, "Oh, I'm tired, I must need testosterone," right?
Mhm.
There's like actual science behind this.
Right.
So what does the guideline actually say? Like what's the deal?
Well, they actually set a specific threshold for
Uh-huh.
what is considered low testosterone,
Okay.
and that's a level below 300 nanograms per deciliter.
But here's the catch. You need two separate blood tests.
Oh,
And
okay.
they have to both be done, like first thing in the morning to
Okay.
confirm it.
So it's like a double check system.
Exactly.
So you're not just jumping to conclusions based on one reading.
Right.
That's interesting.
Yeah.
But what if someone's listening and thinks, maybe I should get tested? What are the signs they should be looking for?
Well, there are the classic symptoms that we always talk about, like decreased energy, lower sex drive, and then problems with like getting erections.
Right.
And those are often what actually brings people in.
Yeah.
But the guideline also highlights some risk factors that might surprise you.
Oh.
Things that you might not immediately connect to testosterone.
Okay, now you've got me intrigued. What kind of unexpected things are we talking about here?
So, for example, did you know that unexplained anemia can be a red flag?
Hmm.
Or bone density loss?
Oh, wow.
Or even exposure to things like chemotherapy
Oh.
or testicular radiation?
Hmm.
Yeah. And then even conditions like HIV/AIDS or chronic narcotic use. Those are all on the list.
Wow, that's a much wider net than I would have guessed.
It is.
So even without those typical, low T symptoms, these conditions warrant a closer look at your testosterone levels.
Absolutely. And once low testosterone is identified, the next step is figuring out the why.
Right.
Like what's causing it.
Yeah, because it's not just about treating the low T. It's about understanding the root cause, right?
Exactly.
So how do doctors kind of go about that?
Well, the guideline recommends checking something called luteinizing hormone, LH.
Okay.
And you can kind of think of LH as the signal from your brain to your testicles telling them to produce testosterone.
Okay.
So if your LH is low, it might mean that the problem isn't with the testicles themselves.
Oh,
It's like somewhere higher up.
interesting.
Yeah.
So if LH is low, does that mean the problem's not with the testicles themselves, but with the pituitary or even the hypothalamus?
Exactly. It helps pinpoint the source of the issue.
That makes sense.
Yeah. And if LH is low, doctors might also look at prolactin levels.
Prolactin. Now, prolactin is that's the hormone involved in breastfeeding, right?
Right.
So what does that have to do with testosterone?
You're right, it is involved in breastfeeding. But prolactin actually has other roles too.
Okay.
And one of those is that high prolactin levels can actually suppress testosterone production.
Oh, wow.
Yeah.
So if both your LH and your prolactin are off, that could be a sign of something that needs attention.
Exactly.
Like maybe even an endocrinologist at that point.
Yeah, that's a great takeaway.
Yeah.
The guideline really emphasizes that comprehensive approach.
Okay.
Looking at the whole system,
Right.
not just isolated numbers.
I like that. A holistic approach.
Right. And it's also really upfront about potential complications, especially when it comes to testosterone therapy.
Okay, let's talk about that. What are some things people should be aware of? What are the potential downsides?
One risk is something called polycythemia.
Polycythemia.
Yeah, and that's an increase in red blood cells.
Okay, and why is that a concern?
Well, if your red blood cell count gets too high, it can actually thicken your blood, and then that can increase the risk of clots.
Oh, wow.
So the guideline really stresses the importance of monitoring those levels, both before and during treatment.
So it's not a decision to be taken lightly. You really have to weigh the potential benefits against the risks.
Absolutely.
For sure.
Another thing to be mindful of is transference, especially with gels and creams.
Transference.
Yeah, and that basically means accidentally getting testosterone on someone else.
Oh, so if you hug your partner or your kids after applying it.
Exactly.
Sure.
Even small amounts can have unintended effects.
Oh, sure.
Especially on women and children. So the guideline really emphasizes taking precautions to prevent that.
Makes sense. I mean, we're talking about a powerful hormone here,
Right.
so safety is key. Okay, so we've talked about the red blood cell thing, and we've talked about the transference. Is there anything else?
Well, another hot topic is the debate about cardiovascular risks associated with testosterone therapy.
Yeah, that's a big one. I mean, heart health,
Right.
understandably a huge concern for people.
Exactly. And what's interesting is that the guideline acknowledges that the evidence is still inconclusive.
Oh, really?
Yeah. So some studies have suggested a possible link between testosterone therapy and heart issues,
Right.
but other studies haven't.
That must be frustrating for someone trying to, make an informed decision.
It is.
It's hard to weigh the options when the answers aren't clear-cut.
Right. And I think the key takeaway here is open communication with your doctor. They can really help you assess your individual risks and benefits based on, your medical history, your risk factors, all of that.
Yeah, because it's not a one-size-fits-all. And speaking of risk factors, let's kind of revisit those conditions that we talked about earlier, like the anemia, the bone density loss. Those don't exactly screen low testosterone, at least not at first glance.
You're right. They might seem unrelated, but there are actually some really fascinating connections there. So let's maybe take anemia, for example. Did you know that testosterone actually plays a role in stimulating red blood cell production?
It's like if your testosterone is low, then your body might not be making enough red blood cells, which leads to anemia.
Exactly.
And that makes sense because anemia can cause fatigue
Right.
and weakness,
Right.
just like low testosterone can. So it's like a double whammy.
Exactly. And I think it really highlights why it's so important to look deeper and, figure out what's really going on instead of
Yeah.
just treating the symptoms, in isolation.
Right. So if someone's doctor sees unexplained anemia in their blood work, it might be a good idea to check those testosterone levels.
Absolutely.
Okay, cool. So what about bone density loss?
Yeah. This one might surprise people, but testosterone is actually crucial for building strong bones.
Oh, really? See, I always thought of bone health as being more about estrogen. Isn't that like the key player?
Estrogen is definitely vital, especially for women, but testosterone is important for both men and women.
Oh, okay.
It actually stimulates those bone-building cells and helps keep your skeleton strong.
So if your testosterone levels are consistently low, it's almost like setting the stage for osteoporosis later in life.
Exactly.
That's scary.
Yeah, and that's why the guideline recommends testing testosterone levels if someone has significant bone loss, even if they don't have those other, obvious signs of low T.
So it's all about connecting the dots and getting that complete picture of someone's health.
Exactly. Now, remember how we talked about chemotherapy and testicular radiation?
Yeah, those are tough.
Right.
Necessary, but tough.
And one of the kind of unfortunate side effects is that those treatments can damage the cells in the testicles that produce testosterone.
So even if someone's, completed those treatments successfully, they might still be dealing with, the hormonal consequences years down the line.
Right. That's why the guideline emphasizes monitoring testosterone levels
Okay.
after those therapies, even, years down the road.
Wow. That's like being proactive about your long-term health instead of just waiting for problems to crop up.
Exactly.
So it's like, hey, we did these treatments. Let's check and make sure everything's okay hormonally.
Right.
That's really interesting. Now, you also mentioned a couple other risk factors that I found really surprising, like IVAIDS and chronic narcotic use.
Yeah.
I wouldn't have intuitively connected those with low testosterone. How do those conditions kind of play into it?
Well, with HIV/AIDS, the virus itself can actually affect the testosterone-producing cells in the testicles.
So it's not just the medications or the stress of, living with the illness. It's the virus that's directly impacting things.
Right. And when it comes to chronic narcotic use, certain opioids can actually disrupt the signaling pathways that control testosterone.
Oh, wow. So that means even if someone's taking those medications, for legitimate pain management, there could be these hormonal side effects to consider.
Right, and I think it reinforces that idea that every medication, even those that are prescribed by a doctor, comes with, potential risks and benefits. And open communication and understanding those risks is key.
For sure. Okay, so we've covered a lot of really interesting risk factors here. Before we move on, though, I think we need to address a topic that's especially important for men with low T.
Okay.
And that's fertility.
Right.
I imagine that's a really big concern for a lot of guys.
It's a sensitive issue, and the guideline actually dedicates a whole section to it.
Okay.
And the bottom line is that if someone is thinking about having children in the future, it's crucial to have that conversation with their doctor before starting testosterone therapy.
Before?
Before,
Yeah.
because there are some important things to consider.
Okay, so what kind of issues might come up? What are the key things to be aware of?
Well, one major consideration is that testosterone therapy can actually suppress sperm production.
Oh, wow. So even though someone might feel, more energetic, have a higher libido on testosterone therapy, it could actually make it harder to conceive a child.
Exactly, and that's why the guideline generally advises against testosterone therapy for men who are actively trying to have children.
All right.
There are other options available that can, address low testosterone without impacting fertility.
That's reassuring.
Yeah.
So what are some of those alternatives?
Yeah. One option is human chorionic gonadotropin, or HCG,
Mm,
and that's a hormone that can stimulate testosterone production in the testicles.
looks interesting.
Another option is clomiphene citrate.
Okay.
And that one works by blocking estrogen receptors, which indirectly boosts testosterone.
Gotcha. So there are ways to address the low T without putting your family plans on hold.
Exactly. And the guideline also really emphasizes the importance of a thorough reproductive health evaluation
Okay.
before any treatment decisions are made.
So what does that evaluation usually involve? What kind of tests should someone expect?
It usually includes a physical exam, a semen analysis to assess sperm count and quality, and then blood tests to check hormone levels, including something called follicle stimulating hormone, or FSH.
FSH. Now, what does that tell us?
So FSH is actually crucial for sperm production.
Okay.
So if FSH levels are high, it could actually signal that the testicles are struggling to produce sperm, even if testosterone levels are normal.
So it's a really important piece of the puzzle when it comes to evaluating fertility.
It is. And in cases of severe male infertility, genetic testing might also be recommended.
Wow.
To get a more complete picture.
There's a lot that goes into understanding the male reproductive system.
There is.
And this guideline really helps, break it all down.
That's what we're trying to do here, Empower you with knowledge.
Exactly.
And help you understand what's going on so you can make informed decisions about your health.
Well said.
Right.
Okay, so we've talked about, the risks, the impact on fertility, but what about the benefits?
Yeah.
What can someone realistically expect if they start testosterone therapy?
Yeah.
What are the potential upsides?
That's a great question. And it's important to have realistic expectations.
Of course.
Testosterone therapy isn't a magic bullet, but it can definitely have a positive impact for some men. We'll dive into those potential benefits
Okay.
and different treatment options when we come back for the final part of our testosterone deep dive.
All right, listeners, stay tuned. We'll be right back with more insights on testosterone therapy and how to make the most of it. Okay, we're back and ready to wrap up our deep dive on testosterone. I'm really excited to dig into the actual treatment options.
Yeah, that's a common question.
For sure.
And the good news is there are multiple ways to approach testosterone therapy. It's not a, one-size-fits-all kind of thing.
That's good to hear. So let's break it down. What are some of the, most common forms of testosterone therapy out there?
Well, one of the most popular options is topical testosterone, which comes in gels or creams.
Oh, yeah, so you just apply it to your skin
Right.
and your body absorbs it.
Exactly. It's convenient, relatively easy to use,
Yeah.
and generally has fewer side effects compared to some of the other methods.
But I remember we talked about that transference risk earlier,
Right.
accidentally getting it on other people. That's something to be careful about with the topical stuff, right?
Right. You have to be careful about getting it on other people, especially women and children.
Okay.
So if you're using gels or creams, washing your hands really thoroughly after you apply it is essential.
Right.
And covering the application area with clothing is also a good idea.
Got it. Okay, so what about injections? Are those still a common option?
Definitely. Injections deliver testosterone directly into the bloodstream, so that can be more effective for some men.
But I imagine there's a learning curve with giving yourself a shot.
Yeah.
Not everyone is comfortable with needles.
Yeah, you're right. Some men prefer to have a healthcare professional, administer the injections.
Yeah.
At least initially. But many men learn to do it themselves at home with a little bit of practice.
Okay, so how often do you need to do those injections?
That kind of depends on the type of testosterone that's used.
Okay.
So some are short-acting, meaning that you might need them every week or two,
Okay.
while others are long-acting, and those can actually last for several months.
So there's some flexibility depending on, your preference and how often you want to deal with those needles.
Exactly. And then we have patches.
Patches.
Yeah, which are worn on the skin, kind of like a Band-Aid.
Okay, so I imagine those work kind of like the gels and creams,
Mm.
just slowly releasing the testosterone throughout the day.
Exactly. Patches can be a good option for people who aren't keen on, like, the messiness of gels or the hassle of injections.
Yeah.
But some men find that the patches can irritate their skin or have trouble, staying put.
So it really just depends on what works best for the individual.
Right. And then there's one more we haven't talked about yet. Pellets.
Pellets, those sound interesting. Tell me more about those.
So pellets are tiny implants that are inserted under the skin,
Okay.
usually in the buttock area.
And I'm guessing they, release testosterone slowly over time.
Exactly. And they can last for several months, which is a big advantage for some men who don't want to think about their treatment, too frequently.
Yeah, but I imagine there must be some kind of procedure to get those pellets put in place, right?
Right. It's a minor procedure done under local anesthesia in a doctor's office. And then there's usually just a short recovery period.
So maybe not as convenient as a gel or the patch, but that long-lasting effect could be worth it for some people.
Exactly. It really comes down to personal preference and what fits best with someone's lifestyle.
Wow, we've covered a lot of options here.
We have.
It seems like there really is something for everyone when it comes to testosterone therapy.
And that's why it's so important to have that, that thorough conversation with your doctor. They can really help you weigh those pros and cons of each option based on your individual needs and preferences.
That makes a lot of sense. It sounds like it's not just about picking a delivery method. It's also about finding the right type of testosterone, the right dosage.
Absolutely.
Huh.
And once treatment starts, monitoring your progress is key.
Okay.
It's not just a set it and forget it kind of thing.
Yeah, so you don't just assume everything's working perfectly. What does that monitoring usually involve?
Well, the guideline recommends regular blood tests to check your testosterone levels,
Yeah.
just to make sure that they're within that target range.
All right.
But it's also crucial to, to pay attention to how you're feeling,
Yeah.
both physically and emotionally.
So it's about more than just the numbers on a lab test.
Right.
It's about noticing actual changes in your well-being.
Exactly. If you're not experiencing any improvement in your symptoms,
Right.
or if any new side effects pop up, that's a sign to talk to your doctor. They might need to adjust your dosage. Or even switch you to a different form of therapy.
So it's all about finding what works best for you and being an active participant in your own healthcare.
Exactly. And remember, testosterone therapy is just one piece of the puzzle.
Right. It's not a magic bullet.
Okay.
What are some of the other pieces?
Lifestyle changes can play a huge role. Things like losing weight if you're overweight,
Yeah.
getting regular exercise,
Okay.
managing stress, all of those things can actually help boost your testosterone levels naturally.
And those are all great for your overall health, not just your hormones.
Exactly. It's about taking that holistic approach.
I love it. Well, this entire deep dive has been incredibly informative. I feel like I learned so much. Thank you for breaking it all down and making it so understandable.
Oh, you're welcome. I'm glad we could, shed some light on this important topic.
Listeners, I hope you feel more empowered now to talk to your doctor about testosterone and, take control of your hormonal health. Remember, knowledge is power. And knowing what to look for and what questions to ask can really make all the difference. Thanks for joining us on this deep dive into testosterone.